Hi, Marcely Bonatto and Mike Gibson coming to you live from AHA 2024, and we are talking about the SARA trial looking at Entresto in chemo-induced cardiomyopathies. Talk to us a little bit about what you did, why you did it, and what you found.
Okay, thank you, Mark, for the invitation. It's a pleasure to be here discussing SARA with you. So, SARA trial is a trial to address how sacubitril-valsartan can prevent the cardiotoxicity induced by anthracycline. As you know, anthracycline are potent antineoplastic drugs widely used for many types of cancers, such as breast cancer, leukemia, lymphoma, but they also carry a very significant dose-dependent risk of cardiotoxicity, including heart failure. And there are many strategies that were tested until now, but they have some controversial results. And we don't have a routine use recommendation for a specific strategy. So nowadays, it's not a consensus what to do with these patients. And a lot of patients need to stop chemotherapy, or maybe at the end of the chemotherapy, they discover a heart failure, and it's a very big problem. So we have some data of animal studies with sacubitril/valsartan who showed a very promising results about the potential of cardioprevention. And this is what SARA trial addressed, the potential of Entresto of preventing sacubitril/valsartan. So we decided to randomize the patients into groups, placebo and sacubitril/valsartan. But there's a detail that's very important to note that SARA doesn't randomize every patient. We select high-risk patients. It was done by the evidence of these patients with myocardial injury.
So what did you find?
Yes, and we find that sacubitril/valsartan was very effective in preventing cardiotoxicity. Our primary endpoint was a decrease of greater than 15% in global longitudinal strain, and we after 24 weeks of treatment, and we found a 77% relative risk reduction of cardiotoxicity. It's a odds ratio of 0.23 with a p-value of 0.015, and so a very impressive reduction in risk of cardiotoxicity.
Amazing. And when you look at that's the relative risk reduction, what was the absolute change or absolute difference between the groups?
Yes, the incidence of cardiotoxicity in the sacubitril/valsartan group was 7.1%, which is relatively low as we are talking about high-risk patients who had already evidence of myocardial injury by the elevated troponin levels. And placebo group had an incidence of 25%, so much
Wow.
higher, yes. And
So an
we
18% relative risk or 18 absolute percent reduction. So you'd only have to take about 5 people to prevent one event.
Yes, the NNT was exactly 5.59. Yes, a very low number. Yeah.
Pretty good math on my part right there on the spot. Well, so does this change practice?
I guess it changed because of two main points. The first one is how to select a high risk patient who may benefit from these strategies. Maybe sacubitril/valsartan and other drugs are not for everyone, but for those with higher risk. So choosing patients by evidence of myocardial injury can be a good way to do it. And the second point is that sacubitril/valsartan was never tested as a prevention drug for cardiotoxicity. To our know, this is the first study to address sacubitril/valsartan as a prevention, and it may increase our options when we talk about cardiotoxicity.
Wow, impressive results. Thanks for sharing it with us. And thanks to all of you for joining us here live from AHA 2024.
Thank you. My pleasure.
Thank you.